nation continues to see a sudden uptick in the COVID cases, we here at Mirror Now want to caution the people. At this point of time, we are joined by top health expert Dr. Naresh Trehan, who is the MD and chairman of Medanta, to discuss the COVID situation in the country. Thank you for joining us, Dr. Trehan, and taking out your time. Dr. Trehan, what do you make of the sudden increase in the number of COVID cases in India?
So, it is not totally unexpected that waves of COVID will come because, like we have said earlier also, that it has now become endemic. Like you will see the wave of flu coming and affecting lots and lots of people, it has become like that in a way. Although the COVID virus actually has a propensity to spread much faster than the other viruses that we see. So it's very contagious. So two things that we need to know. One is that historically, as the mutation takes place in the virus, the next mutation is usually weaker than the mutation before. And that's what we are witnessing today here, is the fact that the people are getting sick, lots and lots of people are getting sick, but the number of hospitalization related to the number of people testing positive is still small. So like Medanta, we actually are beginning to see the admissions. That is we have about 28 patients in the hospital, but they are not very sick. It's nowhere near like the Delta wave. So we are hoping that as time goes by, this virus will become even weaker and weaker and not make people that sick. But today, the XBB 0.16 is creating enough problems in the sense for people. People are getting fever, headaches, body aches. For 3-4 days, this goes on, and then it takes, the fever goes away, they test negative in 5 to 6 days, but then they continue to have fatigue for several days after that. So it's not something that we should take lightly. So there are 3 aspects to it. One is, yes, it's mild. 2, it's contagious. 3, there are enough people who need admissions now. So I would suggest that today, as we have said earlier, it's time to mask in public places. If you can avoid going to crowded places, but if you have to, please use a mask. Second, if in your family you have somebody or yourself have got a cold, cough, immediately mask and isolate yourself. Do not expose the rest of the family members, because what we are witnessing today is that complete families are getting affected by this virus, and then sequentially they get sick one after the other. So I think it's time to go back to the proper COVID behavior that we had established, masking, hand hygiene, and avoiding crowded places, and also isolating yourself as soon as you get any symptoms. If you're getting the symptoms, it is advisable to get tested so that you know whether you have COVID or not, and not to ignore it. But what we notice today, because people are not getting that sick, a lot of people are not getting tested, so we don't know the numbers. But even in spite of that fact, the numbers are climbing on a daily basis, and India has now reached 17,000 plus cases. So I think it needs attention. It needs the public to pay attention for yourself, for your family, for your community, and country at large.
Right. Dr. Trehan, as you spoke about the importance of wearing masks at this point of time, do you also think that the states should make it mandatory? Because wearing of mask at this point of time is an advice that the doctors are giving, but it is not made mandatory. Do you think there is a need to make it mandatory for mask wearing?
Well, if it continues like this, then we should, no question. And especially it could be mandatory that if you're going in public places or crowded places, or if you're traveling in aeroplanes or going and seeing a movie, nothing that you should stop you from doing so, but you mask like we did before. So if you're using those precautions, you're protecting yourself and you're protecting other people from yourself. So I think it's common civic sense to protect everybody around you. And the state governments can actually give this advisory, mandatory to, if you're not appearing in public places without a mask or crowded places without a mask.
Right, Dr. Trehan, let's also talk about the concerns for children here, because that's one group that has not been vaccinated, and of course parents and school tend to worry. What would you say on that?
So, what we have seen, that children are getting infected, but it is not very, very severe. It is mild, and they get fever for 1 or 2 days, and then they get better. So we are really not seeing any major sort of affection when we saw in the last waves, like the Delta and the Alpha waves. It was quite different. Today, the sub mutants of Omicron are getting weaker and weaker. So I think that there'll be a point where we accept the fact that it's not going away. It'll come again, and we just need to be, when we know the numbers are going up, we start protecting ourselves like we should with any other virus that is spreading like that.
Right, Dr. Trehan, my last question to you, sir, before I let you go. We are no more talking about the booster doses. Of course, it holds an importance. What would you say on that? Should people now consider getting vaccinated by the booster dose? Should it be made mandatory? Because a lot of people, after getting 2 vaccination doses, are, of course, worry-free. But should you suggest that booster is important?
So it's a point where the clarity is not there for two reasons. One is that the current mutation that is actually spreading the infection, it seems like it may not be controlled by the vaccine. Like it will be pierce the vaccine shield, and people will still get affected. The second thing is that repeated doses of vaccine, we don't know whether that also does some, because there are people who worry about the fact that could they be getting any side effects. So I think that today we don't know that it's going to help a booster dose. The government has to take a call on that, because it's only being tested in the laboratories, which we can tell whether there is a protection given by the vaccine or not. If it's not given, and we suspect that it is not given, then I don't think that there is any necessity for a booster dose. But if the lab findings are different, then that's the advisory that must come from the government.